At our Dawn Therapy Medical Center, the most common condition we encounter is heel spur or plantar fasciitis. It is treated successfully thanks to the equipment we use. Our equipment is from the Swiss company Shorts Medical, and all treatment protocols for heel spurs, arthrosis, and various post-traumatic contractures are based on it. We have the treatment protocols programmed in our computer, also provided by the Swiss company Shorts Medical. This patient is currently undergoing treatment for a heel spur with us. What is a heel spur? It is a kind of salt deposit, as people commonly say. It can occur with a spur in the center of the heel or without a spur, but the disease affects the entire plantar part of the foot, which is why it is called plantar fasciitis. Thanks to our equipment, I'll say it again, we are able to use all three applicators that we work with. These are the focused applicator, the radial applicator, and the vector applicator. The first one I have in my hands is the focused applicator. The depth of penetration, depending on the attachment we use, can be up to 12 centimeters. Thanks to the focused applicator, depending again on the severity of the condition and the size of the heel spur, we break it up. The ossificate located in the heel is broken down. Of course, we can't remove all of it, but layer by layer, the fresher material is broken down and eliminated. That's why all the shockwave therapy available in our city is distinguished specifically by the fact that we have a focused applicator. The next applicator is the radial applicator. The depth of penetration of the shockwave will also depend on which attachment we use. For this particular device, we have 9 different attachments, each designed for specific purposes. For example, this ceramic attachment is used if we need to relieve pain, inflammation, or swelling. There are other attachments that are better suited for breaking down ossifications. Depending on the procedure, specifically which session it is, and on the patient's condition when they come in for the next session and tell us about any changes, we then decide which attachment to use on this applicator. For example, if we're treating a heel spur, we determine which attachment to put on the applicator. And our third applicator is the vector applicator, which also has completely different parameters and a different penetration depth. This is usually the final stage. So again, if we look at the applicators, focused, radial, and vector, the penetration depth also follows this order. Focused, radial, then vector. And we finish the procedure by treating the softer tissues, which improves nourishment and blood supply to the ligaments, muscles, and everything located in the area we are working on. Here too, depending on the volume and what we want to achieve, there are interchangeable attachments available. For better conductivity, we use a regular gel, which we apply to the area we will be working on. And we start with the focal applicator using minimal power and frequency to locate pronounced pain points in the patient. The patient tells us when we find a point, and at that level of tolerance, we deliver the required number of pulses. Now the first stage of the procedure is complete and we move on to the second applicator. The gel remains in place. We obviously don't wipe it off now. We switch to the next stage and begin the second phase of our procedure. During this stage of the procedure, we focus more on the painful areas we identified with the focal applicator, but we also treat the entire surface of the foot. This process breaks down fibrotic changes, improves trophic supply, and forms a new capillary network. As a result, the entire plantar area receives nourishment, that is, the muscles, ligaments, tendons, everything within our treatment zone. Because of this, the pain syndrome subsides, and the patient experiences a sense of lightness throughout their legs. In other words, the healing process begins. At the next stage of the procedure, as I mentioned earlier, we work on the more superficial layers. That is, everything we have broken down into larger fractions, we now try to soften as much as possible on a molecular level so that all these elements can be easily removed from the body through the circulatory system. The course of treatment usually consists of 5 to 7 procedures, with each session performed once a week. After the first procedure, the patient feels relief. If they come to us with a pronounced pain syndrome, after the procedure, they can already step on their heel, walk a certain distance, and again, the pain may not return at all, though this is individual. With our procedure, we cannot break or damage anything. The only possible effect is an exacerbation of the pain syndrome, but in our case this is actually considered a positive effect. We try, if patients are able to tolerate this pain, which may not even occur, not to use any anti-inflammatory or pain-relieving medications. Why is that? Because the main method and principle of shockwave therapy is to avoid medication-based treatment.